This is Dr. Kavita Patel. She's an internist on the White House staff. She's the director of domestic policy for Valerie Jarrett, who is the the public engagement office at the White House. And she's been very supportive of this effort to help Los Angeles develop new approaches to deal with depression care, and wanted just to give a greeting and best wishes on the behalf of her office. Kavita, I'm putting you on the speakerphone with about 150, maybe it's 200 providers, community members in the Hollywood and downtown area. You might just, and we've just been having a discussion of how can we be not alone in trying to address the economic and health problems of our underserved communities here, and what's the role of this kind of initiative. Okay? And they may have a question or two, so I'm just going to put you up against the speakerphone. Okay. Wait a second, I've got to put you on speakerphone.
So did y'all see Valerie Jarrett on the cover of Newsweek magazine? Works directly with her.
Let's try it now. Let's go.
Okay. Can you all hear me?
Yes.
Oh, good. Okay. I'll shout a little bit because I know our speakers can be testy. So I thank you. I wish that I could even have Valerie on the phone, but she actually is out of the country for a couple of days to come to the president. So I wanted to thank him for letting me get on the phone with you all, because I could be in LA, I think, to make a flight that would get me there and back to the White House in under an hour, and I definitely take it. But in lieu of that, I'm going to tell you how important the initiatives that you're all doing are to not just Valerie, but to the president. They stand for everything that this administration has been fighting for, and what we're trying to do in D.C. and beyond is exactly what I think is at the heart of what your partnerships are about. And we actually just had a conference yesterday that the University of Chicago did on their health initiative, which is not too, it's not too dissimilar to what you all are trying to do. So I wanted to give you a little bit of hope that sometimes when things are hard, and even with the economic times being the worst we've seen, these are the exact types of things that are going to be building blocks in our community. So it's just thrilling to see something that I know I saw the seeds of when I was at UCLA, but to see it growing and maturing the way it does, that's very exciting. And trust me, I'd love to be there with you all, but sitting away in front of my computer someday. So just know that we're here with you as part of the spirit.
Let me see if there's time for, she has to go very quickly, but is there a question or two you would like to ask? Anyone would like to ask of someone at a high-level position in the White House?
Has she told President Obama about CPIC?
I don't know if she's actually told the president about CPIC in particular.
Will you?
All this week we've been really kind of focused on healthcare reform. So that's quite a bit of energy for the White House that's going through Wednesday night. So we're just we're trying to kind of get focused through that. And I don't know if she's told him about CPIC, but she definitely knows about it. So that's, in my opinion, having Valerie Jarrett know about it is pretty darn good. So I think that's a big success for you all.
Let me just briefly summarize for you the community providers and members were sharing their concerns about the difficulty with access to services on the one hand. Also, there are a lot of assets and strengths in the community, and really hoping that there can be a way of bringing things together, a need for more support, especially around people who don't quite meet the categorical funding criteria, but still have a need that's important, and eroding their personal and family life needs. And I think all of that, if I could just sort of say on behalf of the collective here, also there was a really nice comment about the importance of a collective approach to dealing with health problems. And I think all of us would wish the President and the White House best of luck in accomplishing some of these goals that would then end up helping bridge some of the gaps that have been discussed today. And I wonder if just in the spirit of wishing the administration luck, if we could give them a hand. So, yes.
I have a question. I'm an Oxy alum, the president went to Occidental College.
So did I.
A shout out. Oh, great. So my question is, what is the role of what's the presence of mental health in the ideas of the healthcare reform? And another question would be, what sort of incentives would the federal government think about in terms of having states promote and fund more mental health support for the communities?
Substance abuse.
Could you hear that, Kavita?
I heard the part, I think something about mental health and health reform, and then I couldn't hear myself.
And what is there any thinking about incentives that may be needed to expand the availability of mental health and substance abuse services in the community?
Okay, so one thing about mental health, I mean, we made a pretty big milestone with getting mental health parity. That was the first of many needed to be done on health insurance, as you all know too well. A lot of reforms need to come honestly on public systems and Medicare and Medicaid. A lot of what you see that's been talked about with current health insurance protection, so everything from pre-existing conditions to preventive services, all include mental health and behavioral health services. The question I think that you're alluding to with your second part is really about treatment and substance abuse and what we know needs to be done, and especially with team and interdisciplinary approach that really needs to be put forward and incentivized. That's exactly the kind of modeling that we would like to see out in the community, from the different payment systems and reform systems. In terms of real specifics about SAMHSA or NIMH or interrelationships, that has not come through in the legislation to date. But that doesn't mean that I think you all have a very important voice of community to actually have an impact. If you have advice or ideas, the president was pretty clear on Wednesday night that he still wants to listen and hear the best ideas. And I certainly think that means exactly what you're talking about. I know that at the beginning, though, that he really feels like mental health should be carved out. And so pre-existing conditions and the inclusiveness of all of the treatment into a basic health plan is pretty important to him. So we do hope that the cause of mental health will be improved and enhanced with all the things that he's advocated for in his principles, but we know that there's still a lot more work that needs to be done, and that's what I think would be really helpful to hear from you all about models and ideas. And we're looking for things that we can do for the country. So especially if there are other things outside of California, we also want to take that up.
And thank you, Kavita. I hope as the study results come out from this, as you know, that we'll have a chance to share with the public and with the administration, perhaps you and the president, what we're finding, what kind of discoveries the community's been making together, how you can match community knowledge and evidence-based care to make a difference for our underserved populations. So thank you so much let's give Kavita a hand.
I told you he was famous.
Thank you. Bye. Okay. Bye-bye, Kavita.
So you can Google her, Dr. Kavita Patel. Look her up. You'll be amazed.
So it's kind of overwhelming.
It's kind of funny to call into the White House.
So let's make a plan. Who wants to go to the White House with me and tell the president what happens in CPAC?
I am going. So you're not alone. That's what I wanted to say. Okay, you're coming. And the other thing is that we had a comment about this being an ordinary conference. We all go to these conferences, we get inspired, we walk away, we do nothing. So hopefully this is not one of those conferences, because this is the start. It's not something that just happens and then you go away and do your regular thing.